And we are back with Brunch, a taste of Tobago. And like I said, it's a wonderful Wednesday. It's a beautiful day. I am so thankful that I get to share it with you. I'm hoping that you stay with me because it's going to be a wonderful discussion. And of course, I mentioned Dr. Todd Denoon, Dr. T as I call him. And it's always a wonderful time when he's here with me. The flow is amazing. We have those little jokes and that banter that we do. But today we're going to be speaking on heart failure in pets. And I'm hoping that my pet owners and my animal lovers of our four-legged friends and our creepy crawly friends and all those friends that we have in the animal kingdom, I'm hoping that you're viewing Brunch, a Taste of Tobago. So without further ado, let me welcome to the set Dr. Todd Denoon. How are you doing today?
I am fine. Thank you so very much for having me. Good morning, Tobago. I'm glad to be here and to brunch with my bestie.
Yeah, and I was just saying, I haven't seen you for the new year, so this
Yeah.
is like hitting me on all sides because you're here, we get to talk, and it's not even just talking, hey, how you doing? It's actually a conversation about heart failure in
Yeah.
pets.
It's a
So
heavy
it's
topic.
like it's like hitting me on
Yeah.
all corners and all sides. But let's start. Let's get into heart failure in pets. It's such a vast topic of conversation.
Yeah.
Yeah?
So that's really nice that you said it's a vast topic. So the first thing, of course, is that heart failure is not a specific disease. It is a condition that is a sign or symptom of another disease, so some sort of a heart disease that leads to heart failure. So heart failure is a condition where the heart is unable to function adequately. So the main functions of the heart, what do you think are the main functions of the heart? Like this, at its base level, what do you think is the fundamental function of the heart?
Well, for me, it's transporting blood throughout the body. It's
Exact,
pumping that blood in.
exactly. And
Yeah?
that transport is broken down into two parts, which is the receiving of blood from the body and the pushing back out of blood into the body.
Right.
And heart failure could happen on either side of that. So you could have right-sided heart failure, so that is where the heart is not able to receive enough blood. So blood is backing up into the system, or you could have left-sided heart failure. So the blood isn't being pumped out fast enough to deal with the demands of the body. And what that would then lead to is insufficiency of oxygen throughout the body. The person or the individual will start to feel tired, and then you may have other sorts of knock-on effects. So if it's right-sided heart failure, you tend to have fluid being accumulated in the abdomen, because what happens, like for example, if you have a hose and you cork the top, the pressure builds up in the back.
Yes.
And the thing that you don't really recognize with blood vessels is that they're not actually like a solid hose. They are somewhat porous. So when that pressure increases, fluid starts seeping out. And what happens is that, again, it's not being able to receive that blood, so blood is backing up, and then that fluid starts seeping out into the spaces. So that would be in the abdomen, because you have that big blood vessel coming up, taking all the blood from the rest of the body into the heart. And of course, if it's the left side, which is primarily concerned with getting blood out, that blood is coming from the lungs. So a lot of fluid back up into the lungs, and you have very much a lot of difficulty breathing, because where air should be, you now have fluid being. So those are the sort of primary signs and symptoms that you feel. So like a symptom of heart failure with humans would be that they're tired a lot easier, and in your pets, that means that simpler activities, they become very winded, because again, the heart can't produce enough, can't get the blood running around the body to supply oxygen to the muscles for them to do simple things that just you take for granted, like walking to the food bowl, playing fetch, and these kind of things.
You know, my mind is going towards animals and their unique characteristics. So we have large animals versus smaller animals.
Right?
Is there any comparison there with regards to how they suffer from heart failure? Does it bear any precedence to the size?
No, not necessarily. What will happen is that you see changes within the species. So individuals who are more who are heavier, so who have obesity, they of course their heart is of course now trying to manage a body that it's not really built for.
Right.
So the obesity becomes a bigger issue because again the heart has to work harder to pump and to sustain a frame or a body that is bigger than it is meant to. So that would be the main thing. Between species, you would have it a lot more in domestic species, so your pets, because of course they live longer versus farm animals, where again you have a production life.
Right.
So you are reared towards slaughter, so that heart failure tends to be happening in older animals. So in a production setting, you just generally won't have animals lasting that long.
Yeah.
So unless you have animals that have a lot of sentimental value that you've kept around after their production life, and they're now, for all intents and purposes, a pet, then that may occur. So the way that heart failure sets up or presents itself is pretty much the same. Just like it's very much the same, like in humans, as in animals. But again, heart failure is not a specific disease. It's caused by by other diseases that are happening, and then these are the knock-on effects. So those diseases can either be focused on the structure of the heart. So you have two types. You have dilated cardiomyopathy, where the heart is enlarged and the muscles are very flaccid. So it's beating very weakly. So it's receiving the correct amount of blood, but it can't push back out the amount of blood because, again, those muscles are very weak. And this happens more so in dogs. And then you have the other one, which is hypertrophic myopathy, where you have the heart muscles themselves getting thicker and stronger. But that sounds like it's going to be a good thing, but the reality is that it's in a fixed space, and as those muscles get bigger, they close off the spaces where the ventricles, which is where the blood collects. So the blood flows into blood vessels and comes into the heart. That collection chambers, those four chambers, those become smaller. So of course, less blood can be accommodated, and of course, less blood can be received and pushed back out. And that hypertrophic sort of mechanism tends to happen more so in cats, specifically a breed that you don't really see much down here, which is the Maine Coon cat. It's a very large, majestic cat. But you also see that hypertrophy in Doberman pinschers, more so than in other breeds. So that's one of the issues. If you're looking to get a Doberman pinscher, then you do have to look out for that hypertrophic cardiomyopathy.
What about diet? Does diet play a pivotal part in heart failure?
To an extent. So previously, when you can have diet being an important factor in cats, and that tends to be cats that are fed on dog chow or dog foods, because more importantly, cats require a specific amino acid called taurine that is not very readily available because it's not an essential amino acid in dogs. They're not putting it into the food, and then with that deficiency, that affects the heart muscle, and then you could have heart failure. But unlike in humans, hypertension and high salt diets tend not to be a predisposing factor in heart failure in animals. Hypertension, which is high blood pressure, is of a much different origin in dogs and animals, and that tends to be with kidney problems. So the kidneys and the adrenal glands produce hormones that regulate the diameter of blood vessels. So of course, the bigger the blood vessels, the lower the blood pressure. The thinner they are, the higher the blood pressure. So when you have that being thrown off, then you're going to have hypertension, and you do have an issue with the heart being affected in that case, but you're going to be having a lot more comorbidities, which is a word that we've become very familiar with
Yes.
post-COVID, you have a lot of other knock-on effects happening. So you'll have kidney damage, which in most cases would be the primary concern as opposed to the hypertension causing changes to the heart.
Yeah, and you know, we're going to take a break, guys. We're going to be right back with more with Dr. T, as I like to call him. Brunch, a taste of Tobago. Please stay tuned. I promise I'm going to be here. But before I take the break, let me just give you just a snippet of what's going to be happening. So our trivia question for today: where in Tobago would you find the Pool of Asylum? This is a good one. The answer, of course, at the end of the show. Please stay tuned, and we will be right back with more Brunch, a taste of Tobago. We are back, of course. I told you that I would be. We are back with Brunch, a taste of Tobago, and I'm continuing my discussion with my very good friend, in fact, my brother from another mother, as we say, Dr. Todd Denoon, who is on set with me. So, Dr. T, let us just delve in just a little bit. We don't have much time, but I'm hoping that we can speak on what we need to speak on just for our public. So
Other
take
causes
it
of
away.
heart failure would also be, so we spoke about the structure of the heart, the muscles, but also the valves. So valves are structures within the heart that keep blood flowing in one direction. So of course, if those valves become faulty, either because of injury to them or they're congenitally not formed properly and blood starts going backwards, that affects the forward flow of blood and blood being able to go back out. All right, so again, primary issues are the structure of the heart, as well, the muscles of the heart rather, and the valves are generally the main causes of heart disease that can lead to heart failure. All right, so how do we know it's heart failure?
Yes.
So again, the signs that you're looking for would be in your middle-aged animals. If they're not as active as before, they have problems breathing, and of course, if they have a lot of, their belly looks bigger than usual. So not as active, heavy breathing from very light activity, and in worst case scenarios, you see them faint suddenly or they're very weak, they're unable to stand. One recent patient had very sudden loss of strength in the back legs.
Right.
So of course, a lot of the body weight is carried in the back. So they are usually one of the first places to see the weakness. Beyond that, other diagnostic tools that you may need to use would be x-rays to look for an enlarged heart, as well as echocardiography. So you're looking at the valves and you're looking at the flow of blood through the heart. And those are generally, along with the signs that you see, would be brought together to give you a diagnosis. So heart failure, unfortunately, is not curable. And by curable, we mean we treat it and it goes away and the animal is back to normal. But importantly, it is often manageable.
Okay.
So that with medication, you can get an animal back to its normal self. And by normal, we mean a regular amount of activity, a very comfortable life, regular breathing patterns, etc. And we achieve that by a combination of different medications that help to reduce the amount of fluid accumulating either in the lungs or in the abdomen. Those are diuretics, so some of us may know Lasix. Medication that affects the way that the heart beats, so it beats stronger without having to increase the rate of the heart, as well as medication to affect how the size of blood vessels. So again, opening them up so that the blood pressure drops and the heart doesn't have to work as hard to get blood flowing. So those combination of medications are often what we use. And again, this will be chronic because again, we can't cure it. But again, it will be an adjustment to the animal's life. But again, you could have that happen and the animal living a very comfortable life to the point where what may eventually be their demise may be some other issue.
Right.
You may, of course, have an issue where where the heart failure progresses and the medicines no longer are able to compensate.
Yeah.
And of course, at that point in time, which is a touchy subject, a difficult decision will have to be made, which is either to put the animal out of its suffering, which is what we generally recommend, because of course, at the point where you are difficult to breathe, which is something that you do multiple times a minute, it's just a really horrible existence to live. All right. So, fortunately, in animal medicine, you do have the option of euthanasia,
Yeah.
where you can bring it to a clinic, and we can put the animal to sleep. But I often recommend that that not be the first port of call for an animal that has been diagnosed with heart failure. Because as I said, it can be very manageable. So you do a trial dose of the medication. If the animal is responding very positively, then we continue with that medication, adjusting and checking up along the way. And of course, we hope that it's often extremely manageable and we could slow the progress of the heart failure to the point where they could live a long, full life.
Definitely. And Dr. T, I am so thankful that you're here. I wish we could have spent some more time. I just absolutely love speaking with you. But I want to thank you so much for the information. And of course, from our family to yours, we wish you blessings, peace and light, and of course, success in whatever you endeavor to do. So thank you once again.
Thank you for having me. Thank you for listening to me, Tobago. Until next
And
time.
yes, and we're going to take a break, guys. We're going to be right back with more Brunch, a taste of Tobago. Let me just mention our trivia question again. Where in Tobago would you find the pool of asylum? The answer at the end of the show. See you guys for more Brunch when we return.